The Ministry of Health says the 10-day lockdown has been put in place to prevent the death toll from the COVID-19 virus and infections from continuing to rise, as measures taken earlier did not change the figures as expected. In the next 10 days, the government of Rwanda will carry out mass testing across the country to assess the actual status of the pandemic and the severity of the reported Delta variant. Ethan Tashobia.
During a post-cabinet press conference on the new strategies to deal with the third wave of COVID-19 pandemic in Rwanda, the Minister of Health, Dr. Daniel Ngamije, said the previous measures did not bring the country to the point where it wanted in regards to the curbing of the spread of the virus, which is why the new measures included lockdown of Kigali and other 8 districts that have registered the highest number of new infections in the recent days. What the lockdown does is that it reduces the movement of people. The infected people will spend 10 days at home, where you may find that even members of their families are also infected unknowingly. During those days, they will all stay at home, and in the process some will heal, but the most important of this is that they will not spread the virus. That's how new infections will be controlled, and life will return to normal thereafter. Some people have been downplaying this disease since its outbreak, claiming it's for the elderly and those with underlying health conditions, until we started seeing young people die who have not been diagnosed with other chronic conditions, which means that this disease is very serious. The fact that COVID-19 is a serious pandemic is also evidenced by people who believe that there is a real need for concrete measures to combat it and that people should stop downplaying the virus. No one should disregard the measures in place to control the spread of the virus. I get very upset when people get on the bus and immediately remove their masks, and that's where people get easily infected. In the garages and car washing bays, you tell someone to wear their masks properly and they will insult you. COVID-19 is very unforgiving these days, highly infectious and very deadly, which is why we need to put in place more effective measures than we used to. Health Minister Dr. Daniel Ngamije said the national laboratory has now the capacity to test a new variant of the coronavirus called Delta. The Minister of State for Public Health, Dr. Munga Tarsis, stressed that in the next 10 days, the health authorities will carry out mass testing across the country to assess the actual status of the pandemic and the severity of the reported Delta variant. It requires us to examine the variant's DNA, and that makes us aware of what has changed in its genome. This is often found in the people who are newly infected by the virus, in its early stages of contraction, when the carrier has many viruses in their body. It requires that we test those people early, and it's during mass testing that we will see new cases. Among those will include those who did not know that they were infected. In so doing, we'll do a comprehensive research that will show us the status of the virus in the country. The COVID-19 mass testing exercise will also go hand in hand with improving the health care of patients, according to Health Minister Dr. Daniel Ngamije. The other thing that will be done in that mass testing is that patients with severe symptoms will be given antiretroviral drugs and be able to monitor them closely. The whole point is to make sure that patients receive the best possible attention, but also avoid having large numbers of patients, which could overwhelm our capacity, which doesn't help us. Having fewer and manageable cases is our #1 strategy to fight this pandemic. The number of new COVID-19 infections in Rwanda rose from about 30 in early June to about 900 cases a day in July. In addition to this, the number of patients in critical condition and the death toll from COVID-19 are also on the rise. Reporting for RwandaTV News, Ethan Tashobia.